What if I told you that many of the brown spots people call just getting older actually have far more to do with years of sun exposure than with aging itself? And what if I also told you that some of the most popular home remedies people use every day either don't work at all or may even make these spots worse? Today we're going to uncover 5 things many people have never been told about age spots, including one simple habit that dermatologists say is far more important than buying expensive creams. And I want to promise you right from the start that most age spots are completely harmless. This isn't a video meant to frighten you. It's a video meant to help you understand your own skin a little better and to give you the tools to take care of it wisely for the years ahead. My name is Dr. Alan Mercer, and for more than 35 years, I've had the privilege of caring for older adults. One of the questions I hear all the time is, "Doctor, can these brown spots ever disappear?" Today, we're going to separate myths from facts, explain what science actually tells us, and discuss what you can realistically do to keep your skin healthier as you age. So pour yourself a cup of coffee, get comfortable, and let's talk. Let's start with number 5 on our list, and that is understanding what age spots really are. In medicine, we call them solar lentigines. That's a fancy Latin term, but the idea behind it is simple. These are flat brown or tan patches that tend to show up on the parts of your body that get the most sun over a lifetime. Think about the backs of your hands, your forearms, your face, your shoulders, and the top of your head if you're not covered with hair. A lot of people confuse age spots with freckles, but they're not quite the same thing. Freckles usually show up in childhood, they tend to fade in winter and darken in summer, and they're often related to genetics, especially in people with fair skin and red or blonde hair. Age spots, on the other hand, tend to appear later in life, usually after 40 or 50, and they don't fade with the seasons. Once they show up, they tend to stay. Here's something that surprises a lot of my patients. The name age spot is a little misleading. It isn't really your age that causes these spots. It's your cumulative sun exposure. I've had patients in their 30s with significant sun damage who have more of these spots than patients in their 80s who spent a lifetime working indoors or who were diligent about sun protection from a young age. So when people ask me, "Doctor, is this just part of getting older?" I like to gently correct that idea. It's less about the number of candles on your birthday cake and more about the number of sunburns, the number of afternoons at the beach, the number of years spent gardening without a hat, all added up over decades. Let me tell you about a patient I'll call Margaret because her story really illustrates this point well. Margaret came to see me a few years ago. She was 71 years old, and she was a retired school teacher who had spent almost every summer of her childhood on her family's farm in Nebraska. She told me she remembered running through the cornfields with her brothers. No hat, no sunscreen, because in those days, nobody thought much about it. By the time she came to my office, the backs of her hands and her forearms had numerous brown spots, some small, some larger, some blending together. She looked at me and said, "Dr. Mercer, I take care of myself. I eat well, I don't smoke, I walk every morning. Why do I have all these spots? And my sister, who's 3 years older than me, barely has any." And when we talked further, it turned out her sister had worked indoors as a librarian for most of her career, while Margaret had spent decades outside, first on the farm and later gardening as a hobby. Same family, similar genetics, very different sun exposure, and very different skin outcomes. That conversation right there tells you almost everything you need to know about why these spots form. Now, why does this matter so much for people over 60? Well, skin damage from ultraviolet light doesn't show up immediately. It accumulates slowly, silently, over years and even decades, and then one day you notice a spot that wasn't there before, or you notice that a faint spot has become darker and more defined. This is your skin essentially keeping a diary of your years in the sun. It's not a flaw, and it's certainly nothing to be ashamed of. It's simply biology. Melanocytes, which are the cells in your skin responsible for pigment, become more active in areas that have absorbed a lot of ultraviolet radiation over time, and they can cluster together, creating these visible patches. So that's the truth about what age spots are. They are a visible record of sun exposure. They become more common as we get older, simply because we've had more years to accumulate that exposure. And in the vast majority of cases, they are completely benign, meaning harmless. I want to underline that because we're going to talk later about the small number of cases where a spot needs a closer look, but I don't want that concern to overshadow the reassurance I want to give you right now. Most of these are simply cosmetic. They don't hurt, they don't spread like an infection, and they don't affect your health. Now let's move to number 4, and this is something I consider the single most important piece of advice in this entire video. The most powerful treatment for age spots isn't a cream, a laser, or a peel. It's prevention. I know that might sound almost too simple, but let me explain why it matters so much, especially for those of you in your 60s, 70s, and 80s. Sunscreen is, without question, the foundation of protecting your skin from further sun damage. I recommend a broad-spectrum sunscreen, meaning it protects against both UVA and UVB rays, with an SPF of at least 30, applied to all exposed skin every single morning, not just on days when you're heading to the beach or working in the garden. Ultraviolet rays are present even on cloudy days, and they come through car windows and even through some clothing. I often tell my patients that sunscreen should become as automatic as brushing your teeth. You don't think twice about brushing your teeth every morning, and sunscreen deserves that same unthinking consistency. Alongside sunscreen, protective clothing makes a tremendous difference. Lightweight, long-sleeved shirts, wide-brimmed hats that shade your face, ears, and neck, and sunglasses that protect the delicate skin around your eyes are all wonderful tools. And simply seeking shade during the strongest hours of sunlight, generally between about 10 in the morning and 4 in the afternoon, can meaningfully reduce your ongoing exposure. Let me address a myth I hear constantly in my office. Many people believe that because they already have age spots, sun protection at this point in life won't make a difference. I want to gently push back on that idea. Protecting your skin now does 2 important things. First, it helps prevent new spots from forming. Second, and this is something a lot of people don't realize, ongoing sun exposure can actually make existing spots darker and more noticeable over time. So even if you're 75 years old and you've had these spots for 20 years, consistent sun protection starting today can help keep them from getting worse, and it protects your skin's overall health going forward. Another myth I hear often is that a base tan or slightly tanned skin offers protection, so sunscreen isn't as necessary once you already have some color. This isn't accurate. Any tan, no matter how it was acquired, represents damage to the skin at a cellular level. There's no such thing as a healthy tan, even though I know that runs counter to what many of us were taught growing up. I want to share a story about a patient named Robert. Robert was 78, a retired postal worker, and he'd spent 30 years walking outdoor mail routes in Arizona. When he came to see me, his face and the tops of his ears had quite a bit of visible sun damage, including several age spots. He told me, "Doc, the damage is already done, so why bother with sunscreen now?" I explained to him that while we can't undo the decades of sun exposure he'd already experienced, starting consistent protection could help prevent new spots and could help the ones he had from becoming more prominent. He started wearing a wide-brimmed hat on his daily walks, applying sunscreen every morning, and within about a year, he told me his skin felt smoother, and while his existing spots hadn't vanished, they hadn't darkened either, and no new ones had appeared in the areas he was protecting. That's a real, achievable outcome, and I think it's a much more honest goal than chasing the idea of erasing every spot completely. Now let's move to number 3, which is ingredients that dermatologists actually recommend when patients want to address the appearance of age spots. I want to be very clear here. None of these ingredients will make a spot disappear overnight, and none of them work like magic. But there is real evidence behind several of them, and understanding how they work can help you have a more informed conversation with your own doctor or dermatologist. Retinoids, which include prescription tretinoin as well as over-the-counter retinol, work by increasing the turnover of skin cells and can help gradually fade pigmentation over the course of several months. They can also improve overall skin texture. The trade-off is that retinoids can cause dryness or irritation, especially in older skin, which tends to be thinner and more sensitive, so they're often introduced slowly, perhaps just 2 or 3 nights a week at first. Vitamin C is an antioxidant that can help brighten the skin and may offer some protective benefit against further sun damage when used alongside sunscreen, not as a replacement for it. Niacinamide, which is a form of vitamin B3, is generally very gentle and can help even out skin tone over time with minimal irritation, which makes it a nice option for those with more sensitive skin. Azelaic acid is another ingredient with evidence behind it for addressing uneven pigmentation, and it tends to be well tolerated by most people. Hydroquinone is a stronger prescription-strength ingredient that can be quite effective at lightening pigmented spots, but I want to be careful here because hydroquinone really should only be used under the guidance of a physician or dermatologist. It's not something to pick up and use without supervision because improper or prolonged use can cause its own skin issues. I always set realistic expectations with my patients about these ingredients. Improvement, when it happens, is usually gradual, often taking several months of consistent use to notice a real difference, and even then, the result is typically a lightening or softening of the spot rather than complete disappearance. I've had patients who tried a product for 2 weeks, saw no change, and gave up, when the reality is that skin cell turnover simply takes time, often 8 to 12 weeks, before you'd expect to see meaningful change. Patience really is part of the process. And I'll add, anyone with very sensitive skin, or those on certain medications, or those with other skin conditions should really talk with their doctor before starting any new active ingredient, because what works beautifully for one person's skin might be too harsh for another's. Now let's talk about number 2, which is professional treatments that go beyond what creams and serums can offer. There are several options available through dermatologists, and I want to walk through them honestly, including the benefits and the realistic downsides of each. Intense pulsed light therapy, often called IPL, uses broad-spectrum light to target pigmented cells beneath the skin's surface. It's a popular option because it typically involves minimal downtime, though some redness or swelling can occur for a few days afterward. Laser therapy, which includes several different types of lasers designed specifically to target pigment, can be quite effective for age spots, though it may require more than one session, and there can be some temporary redness, swelling, or in some cases, changes in pigmentation, particularly in individuals with darker skin tones. So choosing an experienced provider matters a great deal. Cryotherapy involves briefly freezing the spot with liquid nitrogen, which causes the pigmented cells to die off and the spot to gradually flake away over the following 1 to 2 weeks. It's quick, often taking just seconds per spot, but it can cause temporary blistering, and in rare cases, it can leave a lighter or darker mark than the surrounding skin. Chemical peels use acids at varying strengths to remove the outer layers of skin, encouraging fresher, more evenly toned skin to emerge underneath. Lighter peels involve minimal downtime, while deeper peels can require a week or more of recovery, with redness and peeling. Who makes a good candidate for these treatments? Generally, people in reasonably good health with realistic expectations who understand that these procedures improve appearance rather than guarantee perfection. Who should think twice or avoid certain treatments? Individuals on blood thinners often need special precautions before procedures like laser or cryotherapy. People with a history of keloid scarring need to discuss that risk carefully with their provider. And anyone with a spot that looks unusual or has changed recently should have that spot properly evaluated before any cosmetic treatment is done to it, because you never want to treat a spot cosmetically before confirming what it actually is. That brings us to the most important point of the entire video. Number 1, and the reason I wanted to make this video in the first place, sometimes what looks like an age spot is not an age spot at all. This doesn't mean you should feel alarmed every time you look in the mirror. The overwhelming majority of brown spots on older skin are exactly what we've been discussing, harmless solar lentigines. But dermatologists use a simple framework to help people recognize when a spot deserves a closer look, and I think every person over 60 should know it. It's called the ABCDE rule. A stands for asymmetry. If you drew a line through the middle of the spot, would the two halves look roughly like mirror images of each other? Most age spots are symmetrical. B stands for border. Age spots typically have smooth, even edges. A spot with a ragged, blurry, or irregular border deserves attention. C stands for color. Age spots are usually a fairly uniform tan or brown. A spot with multiple colors within it, such as patches of black, brown, red, white, or blue, is worth having examined. D stands for diameter. Spots larger than about a quarter inch, roughly the size of a pencil eraser, warrant a closer look, though I'll add that size alone isn't the only factor. And E stands for evolving. This might be the single most important letter of all. Any spot that is changing, whether it's growing, changing shape, changing color, becoming raised, starting to itch, bleed, or form a sore that doesn't heal, should be evaluated by a doctor promptly. I want to be very clear about something. Having one of these features does not mean you have skin cancer. It simply means the spot deserves a professional look rather than a guess from a mirror. I've examined thousands of spots over my career that raised a question mark and turned out to be completely benign. But I've also caught early skin cancers because a patient came in and said, "Doctor, this spot on my shoulder just doesn't look like the others, and it's been changing." That kind of attentiveness saves lives, plain and simple. Your regular doctor or a dermatologist can often tell quickly whether something needs further testing, and if a biopsy is ever recommended, please don't panic. It's simply the most reliable way to know for certain what a spot is, and catching anything early gives you the very best odds. Now, before we wrap up, I want to spend a few minutes on some of the popular home remedies floating around online and in well-meaning advice from friends and family, because I think it's important to explain why I don't recommend them. Lemon juice is often suggested as a natural way to lighten spots, but it's quite acidic, and applying it to skin that's then exposed to sunlight can actually cause irritation or even a burn-like reaction. Apple cider vinegar carries a similar risk. It's acidic enough to irritate the skin, especially skin that's already thinner and more delicate with age, and there simply isn't strong evidence that it lightens pigmentation effectively. Toothpaste is designed for teeth, not skin, and the ingredients that make it useful for oral hygiene, like certain abrasives and menthol, can be quite irritating when left on skin for extended periods. Baking soda has a similar issue. It can disrupt your skin's natural protective barrier, and combining toothpaste and baking soda together, which I've seen suggested online, only compounds that irritation potential. And I want to gently caution against scrubbing spots aggressively with any exfoliating tool or rough washcloth, thinking that you can physically buff them away. This usually just irritates the skin and can occasionally make pigmentation worse rather than better. A phenomenon we call post-inflammatory hyperpigmentation. I understand the appeal of these home remedies. They're inexpensive, they're already in your kitchen cabinet, and there's something satisfying about a do-it-yourself solution. But when it comes to your skin, especially skin that's had 60, 70, or 80 years of life on it, gentleness and evidence-based care really do matter more than quick fixes. Let's shift now to lifestyle habits, because what you do for your body overall does show up in your skin, even if it won't erase existing spots. A Mediterranean-style diet, rich in vegetables, fruits, whole grains, olive oil, and fish, provides antioxidants that support skin health at a cellular level. Foods rich in vitamins C and E, like berries, leafy greens, and nuts, help your body manage oxidative stress, which is part of what contributes to skin aging over time. Staying well hydrated helps maintain your skin's elasticity and overall appearance. Getting consistent, quality sleep gives your skin time to repair itself overnight. Keeping your blood sugar well managed, particularly important for those of you managing diabetes or prediabetes, helps protect collagen, which keeps skin resilient. Not smoking is one of the most powerful things you can do, since smoking accelerates skin aging significantly and affects circulation to the skin. Regular physical activity improves blood flow to your skin. And managing stress, whether through prayer, meditation, time with family, or simply a walk outdoors, supports your overall well-being, which does reflect in your skin over time. I want to be honest with you, none of these habits will make an existing age spot vanish, but they support the overall health and resilience of your skin, and frankly, they support your overall health, period, which matters far more than any cosmetic concern. Let me give you a simple, realistic daily routine you could consider, and please remember to run any new product past your own doctor first, especially if you have sensitive skin or other skin conditions. In the morning, start with a gentle cleanser, nothing harsh or stripping. If appropriate for your skin, follow with a vitamin C serum. Then a good moisturizer to support your skin barrier. And finally, and I cannot stress this enough, a broad-spectrum sunscreen with SPF 30 or higher every single morning, rain or shine. In the evening, cleanse gently again, and if your doctor has recommended a retinoid for you, this is when you'd apply it, followed by a nourishing moisturizer to help offset any dryness. Once a week, take a few quiet minutes to really look at your skin. Check your arms, your hands, your face, your shoulders, even your back if you can get help from a family member or use a mirror. If you notice a spot that concerns you based on what we talked about today, consider taking a photo with the date so you have something to compare against if you check again in a month. As we come to the end of our time together today, let me pull together everything we've covered. Age spots are primarily caused by cumulative sun exposure, not simply the passage of time. Prevention through sunscreen, protective clothing, and seeking shade is genuinely the most powerful tool you have. Certain ingredients like retinoids, vitamin C, niacinamide, and azelaic acid have real evidence behind them, though results are gradual and modest rather than miraculous. Professional treatments like IPL, laser therapy, cryotherapy, and chemical peels can improve appearance, each with their own benefits and considerations. And finally, the ABCDE warning signs are worth remembering because while most spots are harmless, any spot that's asymmetric, has an irregular border, shows multiple colors, is growing larger, or is evolving in any way deserves a prompt visit to your doctor. I'd love to hear from you. When did you first notice your own age spots? And what questions would you like answered in a future video? Leave a comment below. I read every one of them, and your questions often become the inspiration for what we cover next. This is Dr. Alan Mercer, wishing you strength, good health, and many happy years ahead. Thank you for spending this time with me, and I'll see you in the next video.